In this video, I'm going to give you 3 breathing techniques recommended by the Psychiatric Times that can help to induce calm, reduce defensive mechanisms, and activate the social engagement system. All right, so back in 2016, Dr. Patricia Gerbarg and Richard Brown, who've done lots of studies on breathing, decided to try and understand which breathing techniques can help people specifically with anxiety, depression, and PTSD. They gathered about 227 participants who were experiencing one or all of those ailments and guided them through various breathing exercises and different techniques for breathing. And they found that there were 3 major aspects of breathing that helped to induce those calm states, reduce defensive mechanisms, and help them to activate their social engagement system. So these 2 doctors are really interesting, and I like their work a lot. In the beginning of this research paper, they actually talk about the fact that prescription medication can dampen overactivity of the sympathetic nervous system, so the fight or flight. But then what they go on to say is that prescription meds actually can't correct for underactivity of the parasympathetic nervous system. So when people aren't able to activate that rest and digest, perhaps what they're saying is that prescription medications aren't the best thing. They go on to say that most parasympathetic pathways are contained in the vagus nerve. And within the vagus nerve, that's where a lot of the communication is happening between the brain and the body. And they found that these 3 breathing techniques really help to improve your vagal tone, or how strong that vagus nerve is. Again, the vagus nerve is the longest cranial nerve in your body that goes from the back of your brain all the way down into your intestine. So when they applied these techniques to the 227 participants in the study, they found that all of them showed significant reductions in fear, stress, depression, anxiety, and insomnia. No other interventions took place other than the breathing exercise. So it just goes to show how powerful and important breathing exercises are for anyone struggling with these things. All right, so let's get to these 3 breathing techniques. Number 1 is slow. Breathing slow, deep breaths. 5 to 6 seconds in, 5 to 6 seconds out. I talk about this a lot, but slower breathing is better. Less is better. Always trying to slow down your breath. When you slow your breath down, you're slowing your heart rate, you're slowing your blood pressure, and you're allowing your body's parasympathetic nervous system to take over. So that rest and digest. That's what you want to be in unless you're exercising or trying to pump yourself up or in a situation where you want to be alert. Number 2 is exhale longer. So again, the exhale is connected to the parasympathetic nervous system. So every time you exhale, that parasympathetic is taking over, okay? So the inhale is associated with the sympathetic. So as you inhale, your heart rate goes up a little bit. As you exhale, it goes down a little bit. So trying to expand or prolong that exhale is always good for getting your body into those calm states. And then number 3 is airway resistance. Now, what that means is creating some resistance in your throat as you're doing that exhale. Now, we've already created a video on the technique called ocean breath. If you've never done that before, you can click above and that video will walk you through exactly how to do ocean breath. But what that is it's just creating a little bit of friction in your throat so that when you do exhale, it allows you to exhale a lot longer, slower, and deeper. All right, so just to recap, if you're someone struggling with anxiety, insomnia, depression, try these 3 things. Slow breathing rate. Try and slow your breath down to at least 5 or 6 seconds in, 5 or 6 seconds out. Second, expand your exhale. So as you breathe in, really slowly as you can, let your breath out. And then third, create some airway resistance. So use ocean breath to try and create a little bit of resistance so that you can even breathe out slower.